Hello, everyone, and welcome, and thank you for tuning in to Health Leaders, the place for peer sourced and solution focused insights for healthcare executives. My name is G. Hatfield, and I'm the nursing editor for Health Leaders. Today, we are talking to Mary Beth Kingston, who is the Executive Vice President and Chief Nursing Officer at Advocate Health, about workplace violence in nursing. So, hi, Mary Beth, how are you?
Great. Thanks so much for having me.
Yeah, thanks for being here. So let's jump right in. Why do you think that workplace violence incidents are continuing to rise despite efforts being made by health systems to prevent them?
Well, I'll tell you, I'm not even sure we can say they're continuing to rise. It certainly feels that way. But one of the big issues we have is reporting. And, in many of our healthcare systems across the country, we have different places that things are reported, or it can be difficult to report. And I'm not sure we have a good baseline to even say that they're increasing. With that being said, it certainly feels as though things are increasing and we're hearing about it more and more. To be honest with you, I'm glad that we are speaking about it. So we are seeing in those areas that do measure, we are seeing some increases in sites where people are really implementing a number of the foundational pieces that we need to have for workplace violence. We are starting to see either a decrease or at least a leveling out. So, some of those things are training, better reporting processes so you can see where the issues are and learn and target your approach. Risk and threat assessment processes, mobile duress, behavioral health response teams. There's a number of basic foundational things that we can put in place to help keep all those providing care safe, and not just those providing care, but everybody in the whole environment safe. It's really about safety for everyone.
Absolutely. So, what are some of the more common reasons that workplace violence incidents occur in hospitals?
Yeah, there's lots of reasons, and it's really multifactorial, which is, I think, sometimes what makes it so difficult to be able to say, here's the formula. Even though I talk about foundational things, to say, here's the formula. And as I've discussed recently, I think that we're doing more and more, which is wonderful, to protect those providing care. We need to do that, but we also need to think about it from the patient's point of view. So many reasons that workplace violence occurs. I'll list some of them. From the patient perspective, it could be a fear of the unknown or a fear of diagnosis that causes them to react, or pain. Sometimes it can result from frustrations in some of our processes, long wait times, maybe not a focus on customer service, for example. Certainly, we have behavioral health issues in many of those we serve. That is not to say that it is patients who have behavioral health problems are the ones that are causing violent incidents all the time. And I think sometimes we do jump to that decision, but there are certainly circumstances. I would also add to that, in terms of a patient diagnosis. Many times, patients with cognitive difficulties are express aggression and violence. And in a number of cases, certainly when you go back and look at them, it's not an intentional thing, but indeed, we still are having that violence occur. Um, I think that substance abuse could play a role. And, this is kind of vague, but I think just the general lack of boundaries in terms of our interactions recently. So, for example, incivility, the acceptance of responding aggressively to interactions. I think that overall in our society has increased. So, again, many reasons, which makes it difficult to have the formula to say, here's what we can do in every situation to prevent or to mitigate. And I'll add one thing too. I think one other thing I would add is that I've seen a number of incidents, or heard of a number of incidents recently, where a patient wants to either leave AMA, or something along those lines, or perhaps they've said something about having some suicidal thoughts or tendencies. And I think we have to be very clear with our teams providing care about where their responsibility lies in those cases, because that often we're balancing trying to keep the patient safe and also to respond to their wishes. There's conflict in that, and I think we have to help all those providing care to, and particularly nurses, to be able to know what they need to do in those situations.
Absolutely. So, how do you kind of redraw those boundaries between patients and nurses or other healthcare providers so that everybody kind of knows what their role is in a situation like that?
Oh, again, it's difficult. And a good colleague of mine has said, if you have one approach, you have one approach because there are so many individual pieces when you're interacting. But overall, I think training does help, training and practice. How we interact and speak with folks. We put signs up in the hospitals. I don't know that that deters violence, but it does sort of say, here's our expectations of having a safe environment. So I do think those type of things helping to set the tone of what is acceptable behavior. But it's really about listening and trying to understand what's going on before something erupts. And that's a skill that is not necessarily intuitive. So again, practicing with de-escalation, even using even having folks act in the patient role and being able to practice that, I think is important. I think we need some advanced training for people in really very high risk areas as well. Um, some veering into some of the self defense pieces. I don't know that everyone needs that, but certainly de escalation. And I think more of a focus on trauma informed care, understanding where that patient is at as they're coming in or being seen in whatever care setting for care, what's happening with them so that we can try to understand that and mitigate it before it becomes very, very difficult. And then, of course, I think we all need to have training in peer support as well, so that we're able to support each other in the work setting. That to me is so important because these situations, as another colleague of mine said to me, if our response is elevated and the patient is not as elevated yet, they will rise up to meet us. So the response that we have is really important. We
Mm-hmm.
don't want to overshoot the mark in some of these situations.
Absolutely. So, where should, nurse leaders start implementing that kind of training? Like, should it start in nurse residency programs or earlier?
Yeah, I think training should start in undergraduate education because I believe
Hmm.
that safety, and this goes along with well-being, focusing on your safety and creating a safe environment is again a foundational thing for all the areas in which we practice. And so talking about that and bringing up these issues in the undergraduate setting is important. um, I would say it's not only a nursing issue. Certainly, that many others are exposed to violence in the workplace as well. We partner, and I think it's very important to partner with your safety and security team. That to me is one area where nurse leaders can make a huge difference. Reaching out, ensuring that we're addressing these issues in the same way. In some situations, the security team will take their cue from the nurse leader or the nurse that's at the point of care. In other cases, security tends to be in the leadership role. But either way, because that depends on the situation, but either way, it needs to be a very cohesive response. So I think that's one piece. Another piece is in advocating for evidence based approaches. Now, remember, there needs to be more studies about what really works. So, for example, we have weapons detection systems in some of our organizations and across the country, we do. Um, that probably has prevented people from bringing weapons in, but it may not have prevented the much of what we typically see in terms of workplace violence and aggression. Yes, weapons are sometimes involved, but not always. So there's debates about that. Look to see what makes sense within your organization, but also go back and look for the evidence about what does work, what truly does help keep people safe. And I think so advocacy and advocacy for resources is really an important thing as well as that partnership. The other partnership I think is with the dyad, with the chief medical officer and our physicians, and really trying to drive that idea that safety is about everyone, and it impacts patient safety too. It's not simply about um, our own physical safety and the patient's physical safety. It can, if you are not focused, if you don't feel safe, you are not necessarily going to be focusing on practicing in the safest way that you can, because your focus is a little bit different.
Absolutely. So that's a perfect segue to my next question, which is how can CNOs specifically help prevent workplace violence?
Yeah, I mean, prevention is not always possible. I'm going to say that, which is difficult. But there are things that we can put in place. I've mentioned a few of them. Again, I'll focus on the training and practice and preparation, partnering with safety and security, and really assessing the physical environment as well as all aspects of the environment. So doing a very or enabling others to do a very comprehensive risk assessment. A simple example might be a triage room, for example, in an ED where the nurse is facing the door and has no way to exit, for example. Those kind of things we can address. I've heard of one of the hospitals across the country. I heard of an incident where a patient smashed a painting and used that glass as a threat. So, look at your environment and just look to see what can be prevented. Um, Working with the community is another piece that I think is very important. Partnering with our law enforcement folks and other agencies in the community, because this is really a reflection of society and the increasing violence in society. And then there are a number of technical things that can be helpful. If you can't always prevent, you can certainly work to um, mitigate the impact of violence. So, for example, you may not be able to prevent someone from getting agitated, raising their voice, but you might be able to intervene so that it doesn't proceed to injury. With some of the technology that's out there now, with where you can have a button or some type of alert on your badge or on some other type of device, and you can alert folks when you need help. That can prevent an incident from going to injury. Behavioral health response teams, where you have individuals at your sites, in any care site, that have some additional training, that when you feel as though a situation is beginning to escalate, you can call for support and have that show of support, as opposed to a show of strength, a show of support for both the patient and for the nurse at the bedside. And there's many other things, but I think they're some of the foundational things. Have a excellent reporting system, so that you know exactly where things are happening, and you can say, here's an area where we have a real problem. What's different about that, and what can we do? So a range of things that can be done, but I think the most important, if I go back, is to say the nurse leaders and chief nursing officers advocating, understanding some of the evidence that's out there, what works best, and advocating in their organizations to implement those, not just technological things, but the processes. And then lastly, supporting those who are victims of workplace violence, and not just the
Mhm.
individual who's involved in it, but it impacts everyone that's present.
Mhm. Absolutely. So that was another perfect segue. How can health systems and CNOs help support their nurses after incidents do occur?
Yeah, it's interesting. I think that again, you have to know about it. So,
Mhm.
I know in different times in my career, I've been surprised to hear about things that have happened. So you do need to have an escalation process, because you don't want something to happen and for folks to not reach out and kind of surround individuals with support. So some type of escalation process, and you should then know who's following up with that individual. I think in healthcare, we've done a reasonable job of initial follow up, but I don't think I mean, we have to recognize that this can have an impact days after and weeks after. And I've experienced that in my own career where I've talked to a nurse that's been involved in an incident, and then maybe 3 months later, I'm hearing from that individual again who's saying I'm still struggling a little bit. So need to have a series of responses. I think so. That's when an individual is directly involved. I do you have a good EAP follow up? Is there enough support? How do you use chaplaincy? So, really having a formal support process, not dependent on the individual manager or leader. This is how the organization responds. So, I think that really is key. The other thing is to not negate um, some of the other types of violence we see. If someone's being called a horrific name all day long while they're working, they may not have a strained shoulder or a bruise or whatever, but they are also experiencing workplace violence. And I think we have to recognize the cumulative impact of some behaviors that we do see. Um, and then along with that, so you have that, and then we haven't really talked about, it's probably another whole view we could take, some of the what we call lateral violence or incivility or bullying at work. And that does still occur in a lot of work settings, but it certainly does occur in healthcare. And I think that's something where we have to support our frontline nurse leaders to be able to address those types of behaviors. And many times they're, again, not something that's reported, because people don't even recognize that always as another form of what we would call workplace violence. But I think I mentioned trauma informed care when caring with patients. So understanding, where the patient's coming from. So is the patient homeless? Have they not eaten? Like there's a lot of other factors we need to understand. The same is true when we're working with our own team members that have been victims of violence, to remember as they re-enter or perhaps just never leave the work environment after an incident, how does that impact how they respond? And we have to be able to understand that too, because it does, as I mentioned, have an impact beyond that initial encounter.
Absolutely. So I want to go back and touch on that community piece
Mm.
that you mentioned. So, what can the communities surrounding hospitals do to support nurses and help decrease workplace violence?
Yeah, I mean, I don't know if the communities would specifically focus on kind of the nursing piece of it, but I think
Hmm.
there's a recognition that there's a need to partner. I will tell you, years ago, there was a reluctance to even say violence and healthcare or hospital in the same sentence, because, we didn't want it just wasn't talked about. And I know, the last few years, as that's been discussed much more openly. I think nurses and others are like, finally, someone's aware that this has been happening, and so the awareness is one thing, because I still don't think that many folks in the community are aware that this is an experience that a very high percentage of those providing care have had. But there's a couple different models, and there's one that our organization is working on right now with our lead in workplace violence, and that's another important thing. The chief nurse can be, uh, a super advocate, but it is really important to have somebody else whose job this is to help move some of these things forward. And we are fortunate in that regard to have someone there. But the model that we've been discussing is called the Cardiff model, and it's because it was first kind of utilized in Wales. And it's a partnership with community agencies and with the local law enforcement to really share data, to track where violence is occurring, to let them know what is occurring within the hospital or when we're seeing injuries related to violence as well. So, really elevating it beyond the workplace and looking at it as a community ecosystem, if you will, of here's violence, here's what's happening, and how can we all partner together to reduce it. And I think those type of collaborations hold great promise, because, like anything else, it's trying to get to the root of the issue of why things are happening. Yes, we want to prevent them, but we many times have to understand what's behind it. And this all starts in our society, and with the increase in violence, and then spills over, given the many stresses people experience in healthcare, it spills over into the healthcare environment.
Absolutely. Well, thank you so much, Mary Beth, for your time. I'm really grateful to have had this opportunity to hear your insights and get to know you. And thank you to our audience for listening.
Well, thank you. I hope a few things I've said have been helpful, but there's so much more work to be done out there. And I think, for nurse researchers and others to really help us understand the best evidence is important. We're getting closer. We have some evidence out there about what works and what doesn't. And we
Mhm.
do know that there's some foundational things. And I really encourage everyone to work with their entire team to be able to implement some of those strategies.